to our annual State of the Union address. This is, of course, the first time we've done it virtually, so so let's see how it goes. It's really my pleasure and honor to introduce Kevin Smith, who will be giving opening remarks. I don't think he needs any introduction. Our fearless leader, who I think has really successfully navigated us and continues to navigate us through this terrible pandemic. So without further ado, Kevin, I'm going to turn it over to you.
Thank you very much, Atul, and good morning, everyone. This is a remarkable team, so it's a real privilege for me to speak with you this morning. First, to thank you all for building the Ajmera Transplant Center truly into a world gem. I remember talking to David Johnston not so long ago when just after he'd left his post as the Governor General. And he's a proud Canadian, as you all are, David especially so. And, we were talking about UHN, and he particularly commented on the Ajmera Transplant Center and said, Canada is a small country relative to the world, but we offer world-class service, that this is a jewel in the crown of Canada's initiatives. I'm sorry, my dog is crying next to me. Just to interrupt, he has to be picked up and put away. Sorry about that. So, and I think David got it absolutely right. Canada is a remarkable place, but it's made even more remarkable by you and the people and the team who make up the Ajmera Transplant Center at UHN. You're really emblematic of what it means to be the three-legged stool of education, research, and clinical care at the highest levels coming together, and truly at the highest levels of each of those paradigms. So be it pedagogy or clinical intervention or the training of the future of the professions, you really are exemplary in what you do in every possible way. And as you know, when we're recognized as one of the best hospitals in the world, the reviewers always comment on the Ajmera Transplant Center as a component part of that. But in paying tribute to you, I also want to pay tribute to the rest of UHN, since we know that pinnacle departments or pinnacle programs like yours doesn't occur without amazing colleagues in the emergency room and a remarkable operating room staff and colleagues, amazing porters and food service workers and people who are doing our environmental care. And never before COVID are we more aware how important the team, the true team, is, and that really everyone at UHN is a clinician, whether you directly touch patients or support those who touch patients. We're all here for one reason, to better serve those who we're privileged to care for. And again, you're the example of what that outstanding care looks like. This has not been a year without challenge, significant challenge, as you know. And Atul and myself and Fayez and Shaf and Terry, we've had a number of discussions, including what do we do about the decline during wave one. But your team and of course the generous donors, be they living or sadly deceased, has really made the second part of the year so successful in catching up. But I know that isn't without its burden on you, the caregivers. And I don't think we can let this year pass without worrying a bit more about you than we ever have. So we know that mental health and physical health intimately linked, and that the kind of work you're doing, again, stressful, demanding in every possible way, and while rewarding, caregivers are sometimes not the best people in the world at recognizing their own needs and recognizing their own humanness. So I hope as we reflect on this most unusual of years, you'll also reflect on your well-being, what will keep you well going into the future. We need you. Your patients need you. Those families need you. Science needs you. The future professions need you. And so selfishly, as well as collegially, I really want you to think about your needs and your well-being going forward so that this remarkable team can continue to have impact around the world. I do want to also just comment very briefly on what lies ahead with COVID. And while we've turned the corner in terms of now having an armamentum of drugs that are coming our way, vaccines, the first has been delivered, the second we hope will come very soon, more to be approved and follow. We're not out of the woods, as you know. Just this morning, we will likely have the largest number of positive cases in Ontario since the pandemic began. And there is this ring around Toronto, as you know, particularly beginning in Mississauga, Brampton, North Toronto, Scarborough, that's tightening and tightening. And of course, even our beds today are making that difficult. And you all saw the media that Ontario Health may ask us to scale back again on elective or scheduled care. So in doing so, we're obviously thinking of the patients and families who are struggling with COVID, but we're also thinking of how do we protect access to this remarkable program. And it's not that often you hear other hospitals worrying about their partners in the same way that they do about UHN. So I want to pay tribute at a recent meeting and a tribute to you folks, where a leader from another academic center actually stood up and said, I actually think we should carefully consider whether scale back at UHN is a wise thing to do with programs like the transplant program. Should we be protecting that and ensuring that carries on, as opposed to others, frankly, carrying more burden on COVID so that transplant patients receive that kind of care? If we'd said that, we'd have been seen as the self-interested, and of course our interest is only in patient advocacy. But having our colleagues say that, I think, is the highest tribute to you one can pay. Fame usually comes from a distance. The farther you go away from an academic center, the more famous it becomes. And the closer you get, the more you see the cracks in the local system. That comment reflects just how valued you are, not only by patients, not only by the scientific community and the learners that you have the privilege of stewarding, but our colleagues at the front lines of care. And I don't think there's any higher compliment than that. I also do want to pause and reflect on the remarkable people who are donors. Of course, our first thoughts are always with those who are cadaveric donors who've lost their lives, and in their final generosity, the most generous gift one can give, offering organ transplantation to greatly change so many lives. But in so doing, we're also mindful of the celebration for the recipient is a tragedy for the donor family, and we think about that. We also think about those live donors, and particularly as we've seen new models of live donation and rotation that is really changing the face of organ transplantation. And we thank them. We know how challenging that is and how upsetting that can be and how disruptive to life. But these remarkable people, many of whom have no relationship to those who, almost all of whom have no relationship to those who receive the organ per se, but coming to the table and putting themselves at some risk to ensure that transplantation can be successful. Last but certainly not least, I know our namesake, the Ajmeras, are with us today, and I'd really like to say a special thank you to the Ajmeras. I know Mr. Ajmera, both son and dad are with us, Sam and I think Tejas. I don't know if Otis is with us today or Shyla, but those that are, I want to say a sincere thank you. UHN could not be prouder to marry our name with the Ajmera name. Remarkable people who've achieved in business what you've achieved in transplantation. Literally world-renowned, best in breed, remarkable environment for work, a remarkable quality of work life, and remarkable products, always looking to science for improvement. So there are many, many analogies of why the Ajmera family made this choice. The first of which is their humanity and their commitment to Canada being truly competitive in every sense. And most importantly, so that patients, regardless of their ability to pay, get the care that they need. And one of the most remarkable things about UHN and Canada is when we see ourselves in that list of top 4, when we look at this transplant program as truly the pinnacle in the world of transplantation, we never have to think there was a single Canadian who couldn't afford it. Your clinical work and scientific work has been guided on need and guided on science, so that those who need the organ, those who need the care, get it, not those who can afford the care get it. And I think being top in the world and combining that with universal access is something so worth fighting for. Let me close by wishing you all a happy holiday. I know for many of you, the holiday will be spent undertaking life-saving transplantation. When you're not there, even though you should be at home relaxing, some of you will be in your labs, but we so appreciate what you do at UHN. You are key members of Team UHN. I couldn't be prouder to work with you, and every time I have an opportunity to advocate for the transplant program, it's a privilege. I hope you'll see in the coming year an increased focus, and forgive the language because not all in healthcare love it, but an increased focus on marketing, because I don't like the fact that every Canadian doesn't know the Ajmera Transplant Center is the largest and most successful transplant center in North America. And we need to make sure that every single Canadian knows the jewel in the crown that you are. So in closing, again, let me thank the leadership team, Atul and the team who are absolutely Joanne, Atul, Fayez, Terry, Shaf. I'm sure I'm forgetting people that I should be naming, and I apologize for that. But in truth, each and every one of you are leaders in this program. And I know the culture of the program encourages that kind of inestimable leadership. So happy holidays. Thank you. I look forward to hearing the rest of your reflections on a most unusual year. Thank you, Atul.
Thank you, Kevin. That was wonderful. So I'll get started. I just remind everyone to mute their mic. I think this picture kind of says it all. It is really a most unusual year, the most unusual year since I've been back here at UHN. Now I'm going to take us back to January of 2020. So when we started January 2020, we had great enthusiasm, great momentum for exciting things to come. We were just ranked in 2019 the 7th best hospital in the world. We had received the American Society of Transplant, which is really the premier international transplant society. We had received an innovation award for them for ex vivo perfusion. We developed our strategic plan, which really was a roadmap out to 2025 for the transplant program. And we, thanks to the generous donation by Sam Ajmera and family, we renamed ourselves the Ajmera Transplant Center. We also had a banner year, coming off a banner year in 2019 of 701 transplants, including over 200 liver, lung, and kidney transplants, 40 heart, and 40 pancreas transplants. And we ranked ourselves for 2020, and this is really amazing, actually. So there are about 300 transplant centers in North America, and these are the top 10 volume transplant centers in North America, and you see we were ranked first, and not the first time we were ranked first, but it was extremely nice to see how we compared against our colleagues in the United States and across Canada. And right in January, we were privileged enough to be featured in this news story that was on CTV, and I'll just play a snippet.
The University Health Network is the top transplant center in North America, and last year it reached a milestone, 700 transplants in 1 year.
I love that story. And this is thanks to this huge team of people, and these are all photos. Of course, these are all pre-COVID photos, since we don't take photos like this anymore, but there's these people and lots of others. And I just want to shout out to, when we last counted, it was about 632 people in the transplant program: nurses, coordinators, admin, social work, pharmacists, all the other allied health fellows, NPs, students, the OR staff, lab medicine staff, researchers, physicians, and surgeons. And I'm sure I forgot many other people, but lots of teams at UHN. And of course, Trillium Gift of Life Network, which is our organ procurement agency in Ontario. And it really takes a huge effort, really a city of people to make what we do possible. Now I'll just briefly give some highlights of 2020 for the individual organ groups. So for heart, liver, kidney, pancreas, and lung. So I'll start with kidney. So kidney had a really amazing year, actually. So our main transplant society in Canada, as you know, is the Canadian Society of Transplantation. And our medical director of kidney is actually president of that society. And Jeffrey Schiff, one of our nephrologists, is president-elect of the society. They also had a stellar year at the awards ceremony there. They actually swept the awards ceremony. Jeffrey got the Education Award, Anna Konvalinka got the Research Excellent Award, and Istvan Mucci won the CST Dragon's Den competition. I'll talk a little bit about that later in the talk. They also had a number of really neat publications, and ranging all the way from really neat basic and translational science looking at proteomics, all the way to quality of life and patient-reported outcomes. So a real breadth of research. Now, the heart program has been increasing their activity year over year, had an excellent year, had a little bit of a slowdown in activity due to COVID, but they are nearing their 1,000th heart transplant, and their first DCD heart transplant is anticipated shortly. They had over 80 unique high-impact publications and numerous national and international leadership roles. Now, down here, this is a tweet from Tim Cook. Some of you may know he's the CEO of a small fruit company called Apple, and Heather has been working with Apple with their Apple Watch to look at remote monitoring of our patients via the Apple Watch. So really cool and exciting research. Now, the pancreas transplant program actually continued their activity right through COVID, and despite COVID, actually set up an islet isolation facility at the CCRM at the GMP labs over at the Mars 2 building. And actually just 3 weeks ago did their first AUTO-ISLET transplant. So where they took the pancreas from the same patient. Here you can see they're cutting up the pancreas and they digest it. And this is Trevor Reichman, Justin and other team members. And they infuse the pancreatic islets into the liver to treat diabetes for this patient. Now, the lung program has had record growth, and you can see here in the blue. In 2019, actually, they did over 200 lung transplants, making them the largest program actually in the world for lung transplantation. And they took a significant decrease in activity because of COVID, and that's understandable because COVID affects the lungs. And so there was a decreased donor activity because we weren't sure if donor lungs were infected with COVID. We had to set up screening protocols. And we also weren't importing lungs. We normally take about 30 to 40 lungs from the United States because we're able to use technologies to repair those lungs. So they're not used in the United States, but are used here. And we weren't able to take those. So we did have a significant decline in lung activity. However, the lung program continued to really innovate in a major way. And these are just some examples, and I have some more a bit later on. But for example, here on the left-hand side, they developed, this is work by Shaf and team, developed a rapid test, not for a patient, a diagnostic test for a patient, but a rapid test for an organ. And this is an organ on ex vivo, where they do this test, and in 45 minutes, they're able to give it a score and tell you if the organ is good or not. And this is really going to revolutionize the way we manage organs even before they go into patients. They also have this neat study led by Marcelo Seipel looking at a special storage procedure and a special storage apparatus to store lungs at 10 degrees and allow the lung transplant to be done during the day rather than the middle of the night. Now, this is, of course, a dream come true for every transplant surgeon, but it also will help make this safer and make it logistically much more cost effective and easier for the whole team, to be honest. And then finally, Cecilia Shapiro, Shannon Wright, Brooke Stewart led a huge 18-center effort across North America to look at quality of life and outcomes in cystic fibrosis patients who get lung transplantation. And this is something we're kind of a model for all the US centers because they see that our outcomes for CF lung transplants are really the best in North America. They had a number of very nice publications. The work by Marcelo and others showed the first experience in North America with uncontrolled DCD. Work by Teresa led the International Society for Heart and Lung on how to standardize sampling of lung fluid after transplantation. And in a world's first, and again, work by Jonathan Young, Marcelo, and others, we did a donation after medical assistant dying at home. And this is a real patient-centered example of donation. And it's something that I think has the ability to really increase the number of donors. And it's something that as soon as it was published, we got international attention. People were calling us from all the way from Boston and Europe, asking for our protocol on how we did this. Now, the liver transplant program actually did not slow down at all during COVID. And so despite COVID, had a record year, over 200 adult and pediatric liver transplants already. So 215 or 16 at last count. And a record-breaking year for pediatric transplants is, as you know, it's our surgeons that are working closely with the pediatric team at Sick Kids, 40 pediatrics with 100% graft survival. And I really want to highlight our live donor activity. So our live donor liver transplant had a record-breaking year for 2020. We're projecting 81 live donors by the end of the year. And this is really amazing. So 16 anonymous living donor liver transplants. So these are people who are donating part of their liver to a complete stranger. And this is a world record by far in terms of anonymous donors. And this was actually selected by the American Society of Transplantation in their upcoming Visionaries Challenge at their Cutting Edge in Transplant meeting. We're also at the 20th anniversary of our living donor liver transplant, and we're going to hit 1,000 living donor liver transplants, way more than any other program in the Western world. They also had a number of really neat publications, the publication of the first living donor paired exchange in North America by Nazia and others. Gonzalo published a consensus guidelines, international consensus guidelines that was featured on the cover of Transplantation. And Mamata worked with the Vector Institute and the artificial intelligence folks to look at adopting machine learning to transplantation. So really cool work. Now we asked everybody to submit their grant funding, and I was going to read off the titles of all the grants, but then I realized there's so many of them that it would take the whole talk. So instead I just put a picture of everybody who got peer-reviewed grant funding in our program. And we have about 50 or so PIs in the program, and you can see that even with COVID, and I don't know where these people found the time to do this, they did manage to get significant grant funding. So over $10 million. And specifically the number of CIHR grants was excellent, with Sarah Crome, Anna, Shaf, Steve Juve, and Teresa all getting CIHR grants, which is a really important benchmark for the program. Now, our best publications are when we work together, and we had two very important publications in the LANCET, which were really multidisciplinary efforts involving people from across all the disciplines. And specifically, we developed a very short course, easy to use antiviral prevention regimen for using Hep C donors. And this has been adopted at centers all the way from Australia to Miami. So it's a really neat stuff. And Leanne Singer led a neat study looking at frailty and outcomes. And this was again a CIHR funded grant, and it was across all the solid organ transplant recipients. And these just show our ability to really work together. And this is, I think, one of the key strengths of the multi-organ transplant program. We also this year had our first ever Living Donation Week, and this was an entire week of really remarkable content, and it was highlighted by a very interesting panel discussion led by Andre Picard from the Globe and Mail, and a number of other events. And and thanks to Paula Neves and her group for setting this up. But what I thought was the neatest thing is we had the CN Tower actually agree to light themselves up green in honor of Living Donation Week. And I did take my kids to see that and take selfies with the CN Tower. This also launched and our first kind of podcast, and this has become a a regular series every couple of weeks, and it's led by one of our nurses who actually won an innovation grant to do this. So Brittany Cole and one of our communication specialists, Courtney Mark, do this Living Transplant podcast, which is really neat, explores issues in transplantation donation from different perspectives, available on Google, Apple, and all the usual social media things. These are just some of the awards I just wanted to highlight. In 2020, Gary Levy got the UHN Global Impact Award, Shaf got the Governor General's Innovation Award, Deepali got an award from the American Society of Transplant, Heather got the Women in Cardiovascular Science Award, Mamata got the very prestigious John Pugliani Prize. In addition to the CST Awards I mentioned before, we did completely sweep the CST Awards. Cecilia got a Clinician Recognition Awards, and two of our trainees got fellowship awards, Adil and Benoit. Now, all of this, if you recall, we were ranked number 7 in 2019, and we moved up the ladder to number 4 in 2020 in the Newsweek ranking of top hospitals. And this is just a write-up from last year. They didn't have write-ups this year, but I just wanted to highlight that really it's all of you and the transplant program, all the work that you do that helps this hospital, that makes this hospital number 4 in the world. It's the largest, I'll just read this, the largest transplant center in North America. It leads transplantation research and innovation, accomplishing many firsts. And that really nicely describes exactly who we are. Now, none of this would be possible without philanthropy. And I just want to highlight our cabinet, and many of these members are here on the line today. Joanne and Kearney and Brendan and Brian Porter, Megan, Blake and Rita Wallace, George Eaton, and many others, Kristen Cooney, Marie DePochi, and then of course folks from our foundation, Josh, Monique, and Nupur. And you can see that we've really kind of accelerated philanthropic growth in the transplant program. So in the last 5 years, and we had a tiny bit of a slowdown with COVID, but in the last 5 years, we've raised over $100 million, which is truly a stellar achievement. And one of the commonest questions I get asked is, well, where does all this money go? And so I just thought I'd spend 2 slides outlining in the last 5 years where these investments have gone. So one of the major things we've done is recruit a number of physicians and surgeons. We've actually almost doubled the number of people in the program, and a number of basic scientists, people like Sarah Crum, Sonia McFarland, Andrzej Trzcinski, and Shin Ogawa, who really worked very closely with our physicians and surgeons, and I think have really built successfully on others we have in the program, such as Li Zhang and Ming Yao. We also developed a number of strategic pillars and invested heavily in them, including organ repair, tolerance, cell therapy, and a number of others. We've also supported a whole host of research ranging from clinical trials to fundamental science to animal microsurgeons to perform animal models of transplantation, and the list goes on and on, 25 million. We've also invested substantially in education to recruit the best and brightest fellows and trainees from around the world with a 4.5 million investment. We've invested heavily in infrastructure. I'll talk a little bit more of that later. We established a special center for living organ donation because I think this is a very important aspect of what we do, and invested heavily. And we invest heavily in clinical support, and this is support for things such as fellows and trainees, and support for clinical translation of the research that we do into clinical practice so that it can get to the point of being funded by the ministry. And this is exactly what happened with Ex Vivo and a number of other programs. Whoops, doesn't want to stay on the COVID slide. Now, of course, okay, I would be remiss if this year I didn't talk about COVID, right? Because it was really the COVID year. And I want to give, well, actually, before I do that, I want to just outline the impact that COVID had on donation in Ontario. And you can see that during the first wave, there was a lockdown, and thanks to Trillium and Darren Treleaven for providing this data. There was a lockdown, ICUs were busy, people were not coming to hospital with strokes and so on and so forth. And donors were actually being turned down because we weren't sure how to screen donors for COVID. And you can see in April at its worst, while we should normally have about 30 to 40 donors a month, we only had 11 organ donors in all of Ontario. And you can see this is reflected in our transplant activity, where we should normally do about 50 to 60 transplants a month. In April, we only did slightly more than 10 transplants. And then we spent the next several months recovering from this. And you can see October, November, we're back up to full activity, 67 transplants in October, over 50 in November, and should be over 50 for December as well. And I want to give a huge thanks to our Transplant ID team. They really navigated us through COVID. They set up something called a COVID team. So Shahid, Deepali, Coleman, Tina, one of our fellows, and Sasan. And actually the 5 of them and several of our other fellows assessed every single one of our COVID transplant patients, about 70 patients so far with COVID who had previously undergone a transplant. So a huge shout out to this whole team. And I also want to highlight some of our COVID contributions that we made to the transplant sphere. So we were part of one of the very first descriptions that was published in the New England Journal of COVID in a liver transplant recipient. We actually wrote the AST guidelines, both for donor screening and the FAQs for organ transplantation. And this actually remarkably has now had over 200,000 downloads. You can see this was published even very early in the pandemic. Before it was called COVID, it was called nCoV at that time. We were critical in participating in the Canadian Blood Services and the CST guidance for organ donation, and we played a critical role in the International Society of Heart and Lung Transplant guidance. Our team also was a provincial resource for ECMO, so this is, traditionally we've used this as a bridge to lung transplant, but in this case it was a bridge to recovery for patients with very, very severe COVID. It's essentially an artificial lung for patients with severe COVID, and special thanks to our ICU team, as well as Marcelo, Eddie, Ewan, and Neil Ferguson, who know how to pose quite well, but also are quite remarkable people. We also very early during the pandemic got a group of international experts and published a global perspective on how to successfully navigate the pandemic. And this was actually really adopted quite widely internationally. And this was sent to be, on the right-hand side, was sent to me by Marcus, and it's in German, so my German isn't very good. But basically what the German government did is they sent this paper to every transplant center in Germany and just said, follow these guidelines for navigating COVID, which was quite nice to see. And then we also set up, if you recall, we were really concerned about donor transmission of COVID. And so our team, our Transplant ID, set up the donor screening guidelines that were adopted by Trillium and adopted provincially, and really allowed us to successfully carry out transplantation. And based on this, we have not had a single case since the start of the pandemic of a donor transmitted COVID infection. Now, finally, I want to talk next few minutes about where we're going. So we will move beyond COVID. We will put COVID behind us. I'm very confident about that. And the future, I think, looks very amazing. This is hopefully me in my future office. Let me sort of go through some of the things that we will be doing over the next few years. So we will leverage technology to enhance care. And this is a program initially set up by our lung transplant team, but now being adopted across the program, that uses virtual apps to care for patients pre-transplant and post-transplant. So in the post-transplant area, we envision a combined hybrid virtual and in-person care model, remote patient monitoring, a 24/7 call line for patients, educational content, embedded video, and asynchronous communication. So this is going to be the way we deliver care in the future. Now, another big story of 2020, I think the second biggest story was the racial unrest and the Black Lives Matter protest in the United States and in Canada. And moving forward, we will strive to ensure equity, diversity, and inclusivity in all aspects of what we do. And this is work by Istvan Mucci and his team, who have looked at ethnic background and race and ethnicity as a barrier to transplantation. And they've actually set up something called the Action Program. This is funded by the Ministry, Health Canada, and it looks at improving access to living donor kidney transplant in ethno-racial minority communities. And Istvan and his team, Paula Neves, Leslie Noor, and many others, have set up all these alliances. So you can see alliances with the Black community, with the Indian community, with the Muslim community, with the Chinese community. So a real remarkable, diverse group of alliances. I think one of the things I think we all recognize is we're struggling with the infrastructure footprint for transplant because of our rapid growth, and we will expand infrastructure to deliver the best care. So this is the Mars 2 building, and I'm pleased to say that construction has now started on the 9th floor of the Mars 2 building. I took a tour last week and I took this photo here on the left-hand side. So it has amazing views, and this will be a remarkable place for learning and collaboration. This is the bridge that joins our current building to the Mars 2 building. The bridge is already built, and we'll have the name of our transplant center on the bridge by next year. And so we anticipate we should be moving here by fall at the latest, and possibly even earlier. We will also, the reason we're moving is to build out the current footprint we're on, the 11th floor of the Peter Munt building, to a state-of-the-art transplant ICU and ACU. And this is going to be 30 beds, all single beds, state-of-the-art isolation facilities. And this is really going to supercharge our ability to deliver really cutting-edge transplant care. And then finally, at long last, we have started construction on our ORL, started as of November 16th. And an ORL, for those on the line that aren't familiar, is an organ regeneration lab or an organ repair lab. We set up the very first one, OR18, but now we're gonna have 3. So this is gonna be advanced care for organs outside the body, ex vivo care in these ORs. So for lung, liver, heart, kidney, pancreas. And we'll also here on the far right have a advanced islet and cell isolation facility. So this is really gonna dramatically enhance our ability to carry out both cutting edge research, but also really state-of-the-art clinical practice in transplantation. We will also push the boundaries of innovation, develop things like robotic surgery, and we've started doing donor nephrectomies using robotically assisted surgery, and we're looking at doing laparoscopic donor hepatectomies or liver donation laparoscopically, which will be quite a remarkable change from what we currently do. Another piece of technology, actually there was a story that unfortunately I think many people missed because of COVID, but I thought was one of the biggest stories of the year, is that the Pentagon officially leaked videos of UFOs and actually acknowledged the existence of UFOs. And this is a photo from above the Toronto General Hospital. So it is not a UFO. So you may have guessed, this is actually a drone delivering an organ. And this is what the future is going to look like. We will also push for new therapies beyond transplant, and this is a cancer initiative led by Gonzalo and Ian and many others. And this is a liver that's riddled with colon cancer, and this is a special transplant procedure specifically for that, where part of the liver is removed, a living donor donates a piece that grows, and then the remaining cancerous liver is removed. So this is really a first for treatment of colorectal cancer to the liver, and we've done 3 such patients so far with success. And this is work by Marcelo and others looking at adopting ex vivo perfusion for treatment of cancer in vivo. So here what happens is the organ is isolated in vivo, inside the body, isolated from the rest of the body, allows you to infuse, for example, high-dose chemotherapy to treat cancer within the lung, so that the chemotherapy does not get to the rest of the body and does not cause toxicity, but cures the cancer in the lung. And this is the first patient here who underwent that with work done by Marcelo. We will also push the boundaries of organ repair and regeneration. And this shows a roadmap for some of the things that we're working on. So on the right-hand side, looking at really neat allograft-directed cell therapies, such as Treg therapies, ILCs, a number of cell types delivered ex vivo. And then on the bottom here is adenoviral viral vector therapy, gene therapy on organs. And then on the top is antibody-mediated targeting of organs. And I'm pleased to say just last Friday, we did a world's first where we delivered an antibody therapy to deplete B cells ex vivo in a patient who then underwent transplantation. So really exciting work. And just as a further outcome of that work, this is work done by Marcus Selzner and Ian Rogers and many others. They're building a kidney, they're bioengineering a kidney. So what they do is they take a porcine kidney, they decellularize it so that you have this scaffold, and you can see this is an electron micrograph of a three-dimensional scaffold. They then repopulate that scaffold with human cells grown for 14 days, and this is the outcome. This is a kidney that's then put on ex vivo, and you can see it's being perfused nicely. And then here,
making a lot of urine.
It's actually making urine. So this needs some ongoing work. We haven't transplanted these kidneys yet, but we are getting there. This is a major advance. And this is similar work using that same methodology, the scaffolding decellularization methodology, work done by Tom Waddell to generate a small rat lung. And then this is a pig lung, and this is work done by Gulnaz Karoubi, where the lung has been decellularized, and it's a scaffold, but you can see that the scaffold actually works quite nicely and inflates and deflates. And so the next step is to recellularize this with human cells in order to create a pig modified human lung. And this is work by Shinagawa, a recent scientist that we recruited, using stem cells to generate hepatic organoids. So this is these in the nice colors here. These are actually little clumps of liver cells that actually do the function that we would expect of hepatocytes. And these are derived from iPS cells or inducible pluripotent stem cells. And he's done the same thing with cholangiocytes from iPS cells to make bile ducts that can then go into a bioengineered liver. So really a neat and remarkable work. We will also be a beacon for learning. So 2020, we celebrated our 300th fellow trained in the last decade. So these are people who, physicians and surgeons who have come from all over the world. And really, your transplant fellowship for most of us is one of our defining moments of our career. So these people go back and they will always remember where they trained and always bring that Toronto learning and attitude and mentality to where they are. And then finally, we will supercharge the delivery of education. And this is work done by our TVA surgery guys, Albert Fung and many others. And this is really cool. So David is in Australia, Fabiola is in Toronto. Her hands are here, his hands are here, and they're learning how to—
Oh, this is a great model. You having fun playing with this?
They're learning in real time how to do liver surgery across the ocean. So really cool stuff.
Oh, this is a great—
Whoops. And then finally, we will continue to do the impossible. So this is Marcelo performing a lung transplant on a donor lung that is 2 weeks old and going into a pediatric transplant recipient. This is, I think, one of the most remarkable things I've seen. The entire lung is fitting into the palm of his hand. And this is the X-ray of the recipient after the transplantation. So I'm going to close by highlighting this is all really possible by an amazing team. And this is a quote by somebody I admire a great deal, and I think it's very fitting here. if the cause is just and honorable, they are prepared to give their all. And this exactly exemplifies what we do. And we do it for these people. These are our patients, some of our patients. And I think our team, we are just humble stewards of the greatest gift that one human being can give to another. And I think our team has risen to this challenge and is engaged in the most noble of activities and has really dedicated their entire lives to pursuit of this. So with that, I want to say thank you for all the amazing work you do. I wish everybody a very wonderful holidays. And if you celebrate Christmas, a very Merry Christmas. And thank you once again. So now if I could ask everybody just stay on the line for a few minutes where we have about 5 or 10 minutes or so. If you'd like to, please turn on your videos, and it'd be nice to see everybody. There's about 200 people on the line or so. And I think if anybody wants to say a few words, I know Joanne would like to say a few words, and then Shaf and Joe and Les would also like to say a few words of thank you to our team. And then I can open it up further.
Thanks, Atul. It's such an honor to be able to speak, and I just wanted to say a few words around our frontline staff through this remarkable year and quite an unusual year. I mean, I wanted to close out this year, the fact that it was also the year of the nurse, and who would have thought when we began 2020 that the year of the nurse would result in really highlighting the wonderful team and staff that we have in transplant. And, you know, it's a time of reflection and gratitude. I think back of when, you know, you showed the graph in April when our transplant numbers really reduced. We were asked and called to duty to actually transform our 6A unit, which was a transplant unit, into receiving patients that were under investigation as we learned how to test patients with COVID to provide safe care. And this team remarkably just kind of rose to the occasion. Our staff volunteered to help out long-term care during the pandemic, to do our part in society and helping others. When I looked at how our team quickly pivoted and was able to be trained to help ICU and in other areas, it was truly, truly remarkable. You know, when our numbers start to decrease in COVID over the summer, you know, we were committed to ramping up our services. We performed surgeries over the weekend. And again, our team kind of rose to the occasion to really meet our mandate to serve those that are in most need. I don't think any of this could have been possible with our incredible leadership team. Our managers, Marcia Cameron, Tatiana Pires, Laura Byers, Susan Kiernan, Rhonda Allen, Francis Hoy, Lori Taylor, all of our PCCs, our educators, our practice leads, and our interprofessional team really did pull together, and it was remarkable in terms of the teamwork. You know, we end 2020 in the midst of wave 2, and there's a lot to think about around continuing to keep our families, our colleagues, and our patients safe, while keeping up our commitment to save lives through transplantation, and also continuing being world leaders in transplantation. And all of those remarkable achievements in 2020 really show how the depth of the team, you know, all of our team members are leaders because they really rose to the challenge. Despite the fatigue and the worries we all carry, I know Kevin, you know, spoke about, you know, our emotional wellness as team members, and that's really important to keep in mind. And I think when I saw team members supporting each other during a time of uncertainty, it really showed our resilience. And we put the word care in healthcare. You know, I heard Brian say that before, you know, there's no healthcare without caring, and that really shone during this unusual time. So I think as we look into 2021, I can't say I have been as happy to see an end of a year, but I am happy to see the end of 2020 and the beginning of 2021, where we strive to be kind of COVID-free, and our steadfast commitment to continuing all of the work in being leaders and our courage during this time. So saying farewell to 2020, beginning 2021 with new hope. I think we should all stand a little prouder of what we've accomplished And I think thank you is just too little of a word, but sincere gratitude and just an honor and privilege to serve. So happy
Thank
holidays.
you, Joanne. Thanks, Joanne. Shaf?
Thanks, Atul. I mean, on behalf of all of us, we'd like to thank you for your focused leadership of transplant in a very difficult time. So thank you. You asked me to say a couple of words about the lung team. And as you know, as everyone knows, COVID is a target, lung is a target for COVID. And so it's been very challenging for us, but our team really stepped up, and certainly in difficult times is when you realize the strength and breadth and talent of the team. So our lung fellows going in and out of hospitals where there's a risk of COVID, but we figured out how to make it safe for them and continue lung transplantation again. They're also the same team that pick up the sickest COVID patients in the province and bring them back on artificial lung support for our ECMO team. Our respirologists and thoracic surgeons were all trained to look after the sickest patients with lung disease, signed up to do shifts in the ICU to help the ICU team who was working so hard, as well as doing shifts on the COVID ward as lung specialists. And our nurses signed up for COVID care and for the protected code blue team. So as Kevin said, we can't have a great transplant program without a great hospital around us. Certainly when needed, the lung transplant team really stepped up to the plate in many ways to help the whole hospital and keep things going. So thank you to all of you for your dedication, and wish you all the best for the holidays and in the new year. Thanks.
Thanks, Shaf. Les, and then Joe. And then I think we'll close after that.
You're there. I want to thank you, Atul. I just very briefly wanted to single out a few people in our program. As you mentioned, we've had a banner year in living donation, and sometimes that's the program that kind of keeps the lights on around the liver transplant program. And with the retirement, perhaps at last, of Gary Levy and of David Grant, leaving a couple of very large pairs of shoes to fill, Nazia Selsner and Mark Cottrell have stepped in and really have driven that program to new heights with record-setting activity. It's been like a blur of living donors and recipients coming and going with our usual excellent outcomes. I also wanted to thank Nazia for her leadership in the very challenging alcoholic liver disease program that has been driving a lot of our transplant activity, and for her being the face of the program with Trillium as well. And finally, we have been short-staffed since earlier this fall with the departure of one of our colleagues, and I wanted to acknowledge our nurses and coordinators and fellows for all stepping up and filling the gap as we recruit to make sure that the care of our nearly 2,000 liver transplant outpatients hasn't been compromised during these challenging times. And so on behalf of my colleagues and everyone, my thanks to our fellows, nurse practitioners, PAs, and our other allied health professionals and our coordinators for what really has been an extraordinary year.
Thank you, Les. Joe?
Thanks. That'll be the anchor. Thank you, Atul, and I'll echo Shaf and Les's comments and thanking you for your leadership through this difficult year, but also with lots of promises going into 2021. I might direct my comments to the kidney transplant team. We've really been an outstanding group of people to work with ongoing, but particularly through this very difficult and challenging year. And you've all displayed an outstanding amount of resilience, poise, and frankly, a lot of good humor as well through these difficult times. So I have to thank certainly my physician colleagues and surgeons, but also particularly our nurse coordinators and admin staff and trainees and social work, HLA, and of course, our amazing inpatient team of nurses and pharmacy, allied health professionals, and housekeeping. So really, we couldn't do what we do without all of you. And I'm deeply honored to be working with such a committed group of people who really look out for the betterment of our patients. And so I want to wish you all a happy holidays and looking forward to a COVID-free year coming 2021. Thank you all.
Thank you, Joe. Okay, so thank you, everybody. It's almost 9 o'clock. So again, wish everybody a very wonderful holiday. I hope you all get some well-deserved rest and relaxation. And thank you once again for all that you do.
Can I just interrupt? I'm just going to say that I think we should all thank Atul for really being the fearless leader and for guiding us through this pandemic and our program and our staff and all our, everything that we do for our patients. And, he really ensures we have all the resources to do our research and look after patients and really fully represent the transplant program on the national and international stage. So I think, yes, we all laughed at your jokes, and just want to thank you on behalf of everybody, and everybody, turn their cameras on. Give Atul a big hand.
Thank you.
Thank you. Wonderful job.
Yeah, a totally unbiased opinion from Deepali.
Yeah, that's right.
Okay, thank you, everyone.
Okay,
Thank
take
you.
care.
Happy holidays.
Thanks.
Bye-bye.
Bye.